school, and we have a lot of grandparents raising their grandchildren that have mental health needs.
The kids,
the grandkids, and that dynamic is so entirely different from the mom, dad, and child dynamic. There's a lot of like independence isn't as fostered because it's a grandparent. I mean, you're gonna parent that child differently. What has been your experience with? Do you have a lot of grandparents bringing in their grandkids?
Sure. So we do have grandparents, and I want to say something about when I talk about parents, very often I'm talking about people in the caregiving role, but the truth is the, mom, dad, nuclear family is rarer than some alternative. I see situations, for example, where, the kid lives with an aunt, and the aunt doesn't even have official custody. She has temporary guardianship because mom's in rehab, right? Grandparents, extended people. And so, I think that grandparents are more likely to focus on love and nurturing and less likely to focus on structure and discipline because of their role as a grandparent and really being attentive. But honestly, there are a number of parents like that too. There are parents who just, they really, really don't want to be the bad guy. They don't want to fight about it. They just let kids run amok. They're kind of overwhelmed and they just let it go. And so I think that it is important for me to acknowledge that families come in many forms. And I would agree with you that grandparents are a different breed. I would imagine sitting down with grandparents and saying, we have to look forward to 10 years from now. I need your help so this kid can be ready. He's not going to be ready like this. We have to figure out how to do this. If this is more support for you, if this is more therapy, whatever this is, I need you to do more toward skills building, discipline, structure, whatever it is, so that this kid can have a future that doesn't involve, being unhealthy and unhappy and disabled, right? And so I think people, when they come in and they're working with you, they want to know that you think that, but you have to find the words and the language to really be direct and say, you got to do more,
Anybody else?
Do you have any ideas as far as like books or websites for resources for we're giving? Because I work in family support for Head Start, so we do outside referrals for parents and we'll give them resources and things like that. Talking about like the kind of things that their child, let's say fostering problem solving at a certain, at different ages, or anything to kind of that in layman's terms that would help them. What kind of things are they independent?
So I do have some. There's a book. I'm thinking the name of it. It's like something detective. I'm trying to remember, but it's like for example, that's an example. There are several books written for kids, and this is kind of a picture book for maybe a 10-year-old looking at Social Spy. That's what it is. That's a good example. There are a number of books that are written for different age groups that are resources for parents and families to navigate development. There's some American Girl books that deal with like peer conflict, and they deal with changing bodies. And so there are different ones out there that really focus on this kind of stuff. And so let me look. I might have some stuff on my laptop. I actually 2 or 3 months ago emailed a therapist in the community who does assessments and asked her that same question, because you always need more to give people. You always need more resources to try to make them go home and work and continue the work and grow,
There's sometimes you have parents that do too much problem solving, and then I've also had the experience with parents who think that a 2-year-old should know better than to do this or that, or a 3-year-old, and you're like, well, really?
Right. And trying to figure out how to get people to be age appropriate is so difficult. And there are really so many books that describe like, this is what it's like in the beginning, and this is what it's like when they're toddlers, and I think sometimes parents need to see that, because it's weird how much.
Well, once they get to school age, it's like they think that's over. Like they look at all the baby stuff, and the months they go through the babies, and then once they get to school, they're like, oh, they're in school. They should be able to tie their shoes and solve their problems.
Right. And then it's really frustrating for me as a professional that sometimes people bring in a kid and they'll say, oh, we're having this crisis. And I'm looking at it and I'm saying, guys, this is development. this, things change and things happen, and it's hard for families to know the difference. Yeah.
Do you have any more tips on how to join with parents? We were talking a little bit earlier about the parents like some resistance to change. You gave some examples of you have to help, I need your help, guiding, instructing, writing down.
So I've gotten a lot of mileage out of that, doing the assessment and then the first meeting with the parents. A whole lot. And again, mostly that comes with teenagers and young adults. But what I find is if I try to see the parents and address their parenting needs with the kid in the room, it's a different dynamic. They're being very careful about what they say. So if I just have that one session and I try to lay the groundwork, okay, this is what I'm going to need from you, and really set that up front, that's very helpful. Most of the time the kids are amenable because I do always say, I don't know you very well yet, and so now's the time to do it, and I think this will help you because we can teach your parent, what they need to do, and then periodically being a resource and saying, you're invited to come. You're invited to come without your kid and say, I can't get my kid to take his meds. What do I do? Okay, what have you tried? Because how am I going to prescribe medication to a kid and they won't take their meds and not talk with the parents about what they're going to do about that? Or, other things. My kid is lying and sneaking out of the house and I can't get a handle on it. What do I do? And so really starting by setting the tone with families by saying, you're part of this. I need you. This can't get better without you. Opens the door for you to start to give feedback. So if you say to people, this mom pops in my head, bless her anxious heart. I treat her daughter who's in her 20s. I think I first saw her when she was about 16. And the mom has 3 children, but this child has always worried her. And the kid's okay. She's anxious, but she's okay. And the mom will consistently, in her panic states, she'll say things to the girl like, well, I know you're going to be on drugs. You're just going to be a drug addict because people like you turn into drug addicts, okay? And in having a relationship with the mom all along, I've been able to say, it's not helpful when you say things like that. It's very, very bad for her. It increases her anxiety. There's no evidence that she's a drug addict. None of that's been going on. And she'll take my feedback. Sometimes she'll even call me to re-regulate and say, can I set up a time, just talk to you for a few minutes and try to deal with myself because this situation sends me into a panic. And so by making part of the treatment a system strategy from the beginning, you open the door better. And I wish we were all doing that. I think part of the reason we don't do it is we don't have time. And part of the reason we don't do it is we're afraid we're violating somebody's privacy. But be mindful that you're not. If I have a kid who comes in and says, I'm sexually active, don't tell my parents, I say, okay. And I don't do a lot of telling anyway. With parents, I do a lot of kind of tell me what's going on and let's do some coaching. Let me write some things out, What about a chart? What about, so I do a lot more of responding to what they're telling me, largely so I don't have to worry that I'm disclosing, but they're already telling me what's going on,
Does that help?
Other phrases that you need in order to, no?
No, I'm just thinking about the parents' resistance.
Yeah.
And I honestly, I've always involved families a lot. I do get a lot from teenagers, my mom's scared of you. I do get that because I do it constantly. Just, sort of, this is the 3rd time I've seen you and I still haven't met with your parents. I'd really like to call them. Can we get a call into the parents? I need to get them here and talk to them. And so I do get, because I give a lot of feedback and parents will get anxious and be like, yikes. But they keep bringing their kids. So they keep paying for it. So, okay. What else we got? We got just a few more minutes.
Can I just say something in relation to what you were saying around because I feel like I have to face that every time. When I get a new family, everyone go in and they feel like you're telling them how to parent, or you're telling them how to correct their children or that kind of stuff. So always making
And to begin early on with a, tell me what your priorities are to solve here. If it's a 10-year-old who can't stop crying, the parents are probably not that worried about the crying. They're probably worried about the fact that she can't do her homework, go to school, and be crying all the time. And so saying to them, what are your goals and priorities and your needs and what's important to you, and taking that history, because we don't sit down and give feedback to our patients and clients without permission. We take a history and we ask them, what do you need my help with? And then they open the door. I think likewise, starting there with parents. What do you need my help with? So the kid says, this is my problem. What do you think the problem is here? And how can I help you be part of the solution to that problem? That, I think, is probably the key, is beginning not with, okay, I'm going to assess your kid and then I'm going to tell you what to do. No, I'm going to assess your problem and I'm going to be a resource to help you solve it. And that makes a difference.
Here's a little gift.